It shows that the COVID-19 pandemic has a serious effect on mental health, from anxiety to the new normal and news of variants of concern. Life has not been the same. How do we boost our mental health and wellness as we get through the pandemic? This is our focus today on sound health. I am Olasumbo Modupe. Thanks for staying with us. The conversation begins after COVID-19 updates. Please stay tuned.
As travel and other possibilities begin to open up in some parts of the world, COVAX urges all regional, national, and local government authorities to recognize as fully vaccinated all people who have received COVID-19 vaccines that have been deemed safe and effective by the World Health Organization. This also includes the 11 stringent regulatory authorities, SRAs, approved for COVID-19 vaccines when making decisions on who is able to travel or attend events. COVAX, in a statement, says any measure that only allows people protected by a subset of WHO-approved vaccines to benefit from the reopening of travel into and with that region will effectively create a two-tier system, further widening the global vaccine divide and exacerbate the inequities caused already by the distribution of COVID-19 vaccines. It would also negatively impact the growth of economies that are already suffering the most. COVAX commends countries that have already shown commitment to equity as well as safety by accepting travelers protected by all vaccines validated by WHO, Emergency Use Listing (EUL), and the 11 stringent regulatory authority (SRAs) approved for COVID-19 vaccines. COVAX call on other nations and regions to do the same. The federal government has threatened to deport foreign travelers who fail to present a polymerase chain reaction test result on arrival into the country. The chairman of the Presidential Steering Committee (PSC) on COVID-19, Boss Mustafa, who made this known, said passengers arriving into Nigeria must present only a valid PCR test to gain access into the country. He added that passengers who fail to comply with the newly revised protocol will be denied entry into the country and would be deported immediately at cost to the carrier airline.
It is still Sound Health on Lagos Television. My guest is Dr. Leonard Okonkwo. He is a clinical psychologist. Welcome to the program, Dr. Okonkwo, and thanks for always obliging us.
Thank you very much.
The pandemic has taught us to change from core social interactions to physical and social distancing. What are some of the elements that make it hard for people to adjust to the new normal?
Well, one thing is that the African culture is one where. Can you hear me?
Yes, you can go ahead.
Yeah, like I said, the African culture is such that there's a lot of social interaction, social support, family support, and so on. And this new normal, where people tend to become more individualistic, is kind of strange. It's kind of alien to the African culture. And that's why it is still difficult for people to adapt to the new normal.
So it is normal to be anxious, but how do you know when you're too anxious? People are even worried about more variants, the news of more variants. Everyday news alerts puts us in crisis mode.
Well, like you said, it is normal to be anxious to an extent. But when the level of anxiety gets to a point where it begins to interfere with your functionality, that becomes abnormal. And in such a situation where it interferes with your functionality, you notice some major features or major symptoms, like biological symptoms like sweating, shaking of hands, your hand trembling, breathlessness, nervousness, sleeplessness, or poor sleep, among others. So when the level of anxiety begins to interfere with your functionality, that's when we say that it is abnormal.
According to a study by the Lancet Global Health, mental health outcomes has worsened significantly for caregivers amid the pandemic, particularly for the displaced and the less educated. There are more cases of anxiety, depression, and parental stress now. What strategies would you share with us if you know if we really want to overcome this condition? Why is it that we have more people stressed or anxious?
Okay, first of all, there is the saying of a popular Greek philosopher that people are not disturbed by the things that happen. They are disturbed by their views of those things. Now, the pandemic came with panic because of the way it came, and it was, an illness that people did not know much about, and there was so much news about people dying, particularly in the Western world, and a whole lot of the kind of people you even hear that are dying are people who you do not expect will just die from such an illness because of their financial or socioeconomic status. So it brought a kind of fear and panic. But the issue here is that it is not the illness itself, but the way people have perceived the illness. They consider the illness as a death sentence. And that is why people panic. Oh my God, is that the end for me, my relatives, my children, my family, my mother? So it brought panic. The real reason why people are anxious is because of the belief they have concerning the pandemic itself. Not the pandemic itself, because as serious as many other kinds of illnesses that we have. However, the way people perceive it is like it is a death sentence. And that's why people are in a panic mood.
One of the concerns cited in the study is that physicians also encounter mental health problems, and they experience this barrier in seeking help and fear of losing their medical license, stigmatization, and a lack of support in the healthcare system. Is this right? How do you think they can overcome these conditions when they actually need help?
Okay, one thing I can tell you about physicians and those in the healthcare sector is that there's a lot of burnout. Too much work. They're overwhelmed with work. Of course, what that simply means is that they're under a lot of stress. And under stress, even the immune system of the individual drops. And that makes them even more vulnerable to COVID-19. So one thing we can do, apart from increasing the workforce, getting more and more people to be involved in healthcare delivery and system, is also, to improve the level of positivity. Like I said, people are not disturbed by the things that happen. They are usually disturbed by their views of those things. So when you help people to be more positive, the level of stress is less, and even their immune system is improved, and their attitude to work is improved. I don't know if you understand what I'm
Yes,
saying.
I do, Dr. Okonkwo.
So that's one way is to get more people involved. One thing we cannot shy away from is that there's a high level of people leaving the country for greener pastures. We have to improve the conditions of those working in the health sector so that more people will stay, will have more manpower to manage the problem, and there will be less stress involved for those who are in the healthcare system.
The more reason I ask this question is because during this pandemic, they're out there at the emergency centers caring for people down with the virus. So most of them end up with they end up with mental health conditions. They end up with depression and anxiety at the end of the day. That's the more reason I'm asking this question. So is there a need for targeted policies to mitigate long-term damage rather than just focusing on the pandemic?
Well, the conditions of those who are out there has to be improved. That is one thing. And apart from just taking care of their physical well-being, even their psychological well-being too has to be taken care of. For example, they also need some form of psychoeducation. They also they need to know how to manage stress, when they're overwhelmed with stress. They also need conditions, better working conditions, not long hours, at work, and very little rest to go with it. These are some of the things that will need to be done, to improve their own mental health, because their mental health is equally important.
All right. At what point do we seek medical help? Are there coping strategies to keep at a normal level when you feel anxiety, depression, when you're depressed?
As soon as you notice that the situation is beginning to interfere with your functionality, you need help. But meanwhile, there are things you can do, or things that people can do to reduce the effect, the psychological effect, on their own health. One of the things that we encourage people to do is to learn the relaxation therapy, which is very simple. It's just a breathing exercise that is very effective in reducing anxiety and phobia. When this is reduced, naturally their functionality is improved. So that's one. And then there are other coping strategies that people need to adopt. So when they adopt these coping strategies, it helps them to cope better with the situation. I don't know if that will permit me to go into some
Go ahead, Dr. Okonkwo.
coping strategies.
You can go ahead with them.
One of them is the breathing exercise. Another one is positivity. In fact, spirituality is one of those coping strategies that help to cope with anxiety and improves the overall mental well-being of the individual.
Okay, Dr. Okonkwo, you can go ahead with the details of the coping strategies. You have enough time, sir.
All right. Now, like I said, people are not disturbed by the things that happen. They are disturbed by their views of those things. All right. So when people are encouraged to be more positive, they are able to cope better. Let me say this. There are two ways to cope with stress. All right. One is the what we call the problem-focused approach, and the other one is the emotion-focused approach. In the problem-focused approach, you remove the source of the problem, and then the stress or the anxiety just goes. But unfortunately, we can't do that with COVID-19 because it is there. In as much as we want to remove it, we cannot, at least for now. So we are faced with the coping, the emotion-focused approach. And that is learning to change the way you see the disease itself. If you see it as a death sentence, then it will affect you because all you think about is death, death, death. even going to be involved with people who are victims or who are already down or infected, will give you the impression that, oh, I'm playing with death. But it is not a death sentence. So when you change the way you see it, then the effect on you will change. And then you become even more positive. Then apart from that, there are other things that will enhance, that generally will enhance your mental health, like adequate sleep. People tend not to take adequate sleep, and then if you are not sleeping well, definitely it affects your mental health, and it affects your ability to cope. Sleep is like water that will naturally find its level. So if you are not sleeping adequately, that means something is blocking your sleep. To cope well, you need adequate sleep. You also need to eat well. You can't cope well if you are not eating well. Helping your body to build up the necessary resources, all right, to cope. So you have to eat well. Then exercises. You have to be involved with physical exercise. That will also stimulate your body system, all right, to be able to cope. And then it makes you more confident. And that enhances your positivity, because you know that you are physically healthy, you are mentally healthy. All right, so that's another one. There's also the role of music. People underplay the role of music in everyday life. It has been shown that music helps us to cope better with the stresses of life. So I always encourage people to have a way of playing music at their background, particularly when it's not going to be distracting to their whatever they are doing. Particularly at your leisure time. Spend time listening to music, and so on. These are some of the things you can do to cope well, all right, under the circumstances.
All right, thank you so much for your insights on how to boost our mental health. Thank you so much again, Dr. Okonkwo. We really appreciate you.
You're welcome. Thank you very much for having me here.
I have been speaking with Dr. Leonard Okonkwo, a clinical psychologist. Sound Health continues with health updates. Please stay tuned. It is still Sound Health on Lagos television. It is okay to feel anxious at this time due to the pandemic, but it has to be at optimal levels. Seek medical help early enough if you feel concerned about your condition. This is where we say thank you on this week's edition of Sound Health. Remember to stay safe and observe all precautionary measures. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.